Hello dear patients, in this video let's talk about the aesthetics for our male patients. One of the most common problems about the male patients is the gynecomastia. So how do we approach the gynecomastic tissues? First, you have to know that all males, all men have some glandular tissues, the breast gland tissues below the areola area. So in these male patients, sometimes because of using steroids or hormones or just genetically, they can grow up. But it's called, there are two ways of gynecomastia. One is a real gynecomastia, that means that you have a lot of glandular tissues like milk channels, milkways, they're so hypertrophic, and when you touch it, it's really firm and tough. And the second part, the second version of this gynecomastia is called as pseudogynecomastia. It's not a real breast glands or milk ducts inside, but you see a kind of big mass below your chest area. It's usually the fat. It's not only the glandular tissues, but because of the fat hypertrophy, you see big breast. It's called as gynecomastia. And there are some levels of gynecomastia, level 1, level 2, level 3. And these kind of levels is just telling us how much volume is inside the breast, or how much skin is excess in the chest wall. So let's start from the beginning. Our approach is different for pseudogynecomastia and the real gynecomastia. But the therapy, the cure is almost the same. It's to remove the glands or fatty tissues. If it is a pseudogynecomastia and not a real breast glands are there, only fat is located on there, it's very simple to understand. We can just check an ultrasonography. We can see if it is gland or if it's just the fat. So in the areola, the male's areola is small, and you can make it maybe 1 centimeter of small incision in below the breast areas, and you can remove the fat inside very easily. If there is not a lot of skin, then the skin can shrink after the liposuction. Of course, the skin can shrink, and you can see a nice shape in pseudogynecomastic patients. I mean the patients with only fat deposit inside. If the patient has more skin tissues, and if you think that after the surgery the skin can be droopy or saggy, it's better to add a kind of help for us. It's the J plasma, of course. It's going to help your skin to tighten more, and you don't see so much saggy tissues after the surgery. But in some conditions, J plasma can also not be enough. Even you suck out the fat inside, the male patients sometimes have more extra skin, and you may need to make a semi-areolar or semicircular cut above the nipple, or a total circular cut around the nipple, to make the breast skin much more smaller. It's going to reduce the extra skin around this area to help you. So these are the steps. And if the patient has a real gynecomastia and it's not only the fat, even we start with the liposuction as the same, and after the liposuction of the tissues, you will see that the fat will go, but the glandular tissues will not come out with the liposuctioning. So we make a little bit longer cut, maybe 1 or 2 centimeters cut just below the areola, and we just pull the glandular tissues outside and we cut them in a direct vision. And this is going to help us to have less glands inside, and it's going to just decreases the risk of the potential recurrence of these gynecomastic tissues. And this is the simple way. It's the same. If you have extra skin, you may need a J plasma or you may need a skin cut. But just the difference is, if there is breast glands left, you need to make a little bit longer incision. You need to remove the glands, and you need to have more effort to make a smooth chest wall. It's much more easier in the pseudogynecomastia or fat deposits. You just only suck the fat out. You give a nice shape with just sculpting, and it's very simple. Okay, thanks a lot. See you in the next video.